Hi, I'm Dr. Eli Camp.
And I'm Dr. Judith Thompson. And today we're going to be talking to you a little bit about how we came up with the information for the book. For myself, I went through and I was very interested in the actual statistics of how many children were getting these infections. How often did we see them coming up? What were the rates of transmission? How were these conditions passed from child to child? And so I went through and, the main reporting site for the United States is the CDC, the Centers for Disease Control. And so I've been keeping track of these numbers for the last, let's say about 13 years that I've been doing this. And so I've been looking at it, and year by year, there'll be reports by state and sometimes by counties. And so I've been keeping track of it and looking at it. It's one of the interesting things that I found that happened this year was actually in 2017, because they used to give us just straight numbers, right? They would say there were 1,000 cases of this, 100 cases of this, whatever it was. But this year it changed into percentages. And that was alarming to me, partly because, in some conditions like rubella, for example, is one where we've had about 20 cases of it in the last 10 years. So it's not something that's really prevalent in this country, which means we've got about 2 people per year that might be diagnosed with it. And so if all of a sudden we have a 100% increase, that would mean 4 people. But that could be enough to get people really scared to maybe do something that they didn't want to. Maybe, once fear gets in there, we might make different decisions. So that was part of my kind of history of looking at these records and how they're showing up for us today. But there was another aspect. And so, Dr. Eli, do you want to share your side of bringing things together?
Yeah. So, most of the organisms, bacterial or viral agents that are behind the childhood illnesses have been with the human population for a really long time, way before vaccinations were even a thought in any scientist or doctor's mind. And so they were clearly able to survive them because the human race is still here, right? We haven't been wiped out. And so in order to find the information on how healers in the past, doctors, other sorts of healers dealt with these childhood illnesses, I really had to dig deep into the old literature. So some of it is the old literature of MDs back in the early 1900s. Some of it is literature from, the allied health fields of herbalists and Chinese medicine doctors and things like that. But it was really a case of let's dig down deep. I almost had an image. I'm a Harry Potter fan. And so, those old libraries with shelves and shelves and shelves of old books. I mean, I feel sometimes like that's what I was doing, was digging through all that old literature. But the information was there. Doctors used to treat childhood illnesses with support and rest and addressing basic health, as you'll see in the book and as we talk about this stuff. So, yeah, that's sort of my story of it.
Yeah, so bringing all this information together took each of us years in researching and gathering all of it. And so now we have it available for you. And if you did want to purchase the book, you could go ahead and go to our website, vitalhealthpublishing.com, and download a free chapter if you'd like to know kind of the layout of the book and go from there. So thanks so much for joining us today.
Absolutely. Be sure and like and follow us, share our site with your friends, and come back and join us for more videos as we go forward.